Steve Frank initiated this study many years ago, and it's a phase 3 randomized trial of intensity-modulated radiation therapy, IMRT, versus intensity-modulated proton therapy, or IMPT. This is the long-awaited proton versus photon phase 3 trial in head and neck cancer. Proton therapy is a much more focused type of beam that we use, which allows for sharper fall off of dose. So everybody was kind of really excited that by using protons and having less scatter radiation, we'll be able to hopefully have the identical cure rates and reduce side effects. In fact, Steve Frank did an amazing job, and everybody who accrued to that trial. And what they found was, indeed, protons do not compromise any outcomes. People were worried, oh, it's so tight, maybe you'll miss the tumor. There were no increases in recurrences. The survivals were the same, which means you're not losing anything with protons. And then when they looked at functional outcomes, specifically feeding tube use, the feeding tube rates went down significantly in patients who had the proton therapy instead of the photon therapy. Not only did less patients need a feeding tube, the duration, the amount of time they had a feeding tube in, went down dramatically. So this is a huge study, and I think it gives finally some really high quality level 1 evidence that protons actually cures cancer just the same, reduces side effects.